Good morning, good afternoon. I'm just going to wait a couple minutes and see if we can have a few more people to join us. It's a busy first day back from the holiday. We'll start in 1 minute. All right, I think I'll start. Welcome to our second Tech Talk. I'm hoping you had a wonderful long weekend. I'll start by saying for any procedures demonstrated and discussed today, check with your facility veterinarian before implementation and follow your facility SOPs, protocols, and CCAC guidelines, of course. Today we have Dr. Nanka Dimitrova, who works at the University of Toronto Division of Comparative Medicine. She'll be talking to us today about intraperitoneal injections with mice. Nanka, welcome.
Oh, thank you, Christina, and hi everybody for joining us today. So first, I wanted to start with, they say that it's a very special day today because it happens. It's the only day in the decade because it won't happen again until 2080. So it's 22nd February, second month of the 2022. So I'm going to consider it as a lucky day and hope this luck comes to you and brings you happiness. So we are going to discuss today an intraperitoneal injections in mice. I'm going to, my screen is shared already, but we'll go slide by slide, and you can type your questions at any time or at the end of the session, whatever you feel most comfortable. So let me just, I'm not a very tech person. I'm just going to, let me just see how I can click on my next slide. Okay, so first I usually like to discuss first the anatomy and what is the peritoneum and what is the peritoneal cavity. So the peritoneum is the serous membrane that covers the abdominal cavity, and the peritoneal cavity is a closed cavity that contains all of the abdominal organs except the kidneys and the adrenal glands, which are into the retroperitoneal space. The peritoneum, it's divided on parietal peritoneum and visceral. So the parietal covers the abdominal wall and the diaphragm, and the visceral peritoneum covers all the abdominal organs and gives them a protective layer. So usually in lab facilities and in the work with rodents, injection of substances into the peritoneal cavity is a common technique. but it's rarely used in larger mammals and humans, and you would probably ask why. The reason why is that the intraperitoneal injection gives us, it's mostly used because the venous access to the animals, they have very small veins and arteries, and it can be challenging. And that's the reason why the intraperitoneal space, it's used for injections, and it gives us an access to administer a larger volume of fluids, or at the same time you can do a surgical implantation of osmotic mini pumps, which is a different topic. The other thing to consider with those injections is that the absorption of the material that is delivered intraperitoneally, it's typically much slower compared to the intravenous injection. Important thing when you are doing those type of injections, it's firm restraint of the animal, positioning, proper angle, and landmarks. You have to make sure that you restrain the rodent safely and securely, as is demonstrated in your animal handling training in your facility. It is very important to be calm and not stressed, and prepare everything in advance that you're going to need, because as all of you know, animals sense our own emotions. We're stressing them additionally from tilting the body down, from restraining. So you have to be yourself as calmer as you can and try not to rush. I have a little trick myself that I do, and I usually, when I restrain the animal, I would pat them under the chin, which I found that it really calms them down. So you can try this as well and see what you're going to find, but that's my little trick, to calm them, to pat them under the chin, and you can slide your finger slowly over the body, and you're preparing them that you're going to do something. So the landmarks, usually with the IP injection, it's you're making an imaginative line through the midline of the body. And the second line is the top of the hips. Usually in the females, the top of the hips line is adjacent to the second last set of nipples. And so your target injection site will be between those two sets of nipples in females and into the same imaginary space in the males. The other important thing is that the recommendation is to do the injections into the lower right abdominal quadrant. And the reason why is, if we go back to the first picture with the anatomy that we discussed, the peritoneal space, you're going to see there how the organs are positioned, and you have much less organs into the right side compared to the left one. So usually on the left one, you would have the cecum. On both sides, you would have the urinary bladder. If it's enlarged, you have to be careful there as well. So preferably go into the lower right abdominal quadrant. You can do, for chronic repeat injections, you can alternate sides as well, but make sure that you always aspirate and draw back before you're injecting a fluid there. Another important thing is following proper angles. So once the mouse is secured with the animal vertical and facing towards you, tilt the head and the body towards the floor at approximately 45-degree angle. Usually this technique will allow the organs to fall away from the injection site. They're going to move cranially, and they're going to decrease the chances of injecting a substance into an organ. Another important thing is when you're the angle of your needle that is going. So when you're inserting the needle, always make sure first that your bevel of the needle is it's upwards and not downwards. The reason of this is if it is downwards, you would have more resistance and you would cause the animal is going to feel more pain compared if the bevel is up. The angling of the needle should be approximately 30 to 40-degree angle. And the reason why of this angle is usually if you use a smaller angle, it is probably going to go into the fat. If it is a smaller angle, if you use a bigger angle than this, it might go into the small intestines. So we always have to be sure, use that angling 30 to 40 degrees, also dependable on the size, on the length of the needle. It depends how far down you're going to insert it. Usually, so if you use, the recommendations are between 25 to 28 gauge of a needle for IP injections in mice. If you're using the 25, you can do ½ an inch into the peritoneal cavity, not the whole needle until the hub, because that's going to be too, it will be too lengthy and you might cause damaging to the intestines. Usually the 26 and the 28s, they're 5/8 of a length, so they're much, they're smaller in size. It will be easier. Always aspirate before injecting to be sure that you're into the correct location. If any material, when you draw back, if any material, if you see any material aspirated into the hub, you have to make sure that you remove the needle and the syringe, discard, don't inject, and use a new needle and syringe when attempting the injection again. A new needle and syringe must be used for each injection. It has to be sterile. The fluid injected needs to be sterile as well. Once you're in the correct location, administer the solution in a slow and steady motion. It is very important when you are making the drawback and injecting, not to move your hand. So practice this multiple times before you do it on an alive animal to make sure that your hand doesn't move, because with a millimeter move when injecting, and if your hand moves, you can actually go into an organ. So after this is done, remove the needle in a smooth and steady fashion. Slowly return the mouse to normal position. Ensure there is no bleeding or reaction at the injection site, and return the animal to its cage. This is a little video that actually my daughter helped me, and she was filming it. So I'm just going to play it for you. There is no talk, but we've discussed everything. So proper restraining of the mouse. Here, oh, sorry. Just have to go back. it is important to uncap your needle prior, but still keep it into the protector. Bevel up, your animal is restrained, not moving, injecting, drawing back. Try not to move your needle when you're injecting. Withdraw and place the animal back into its cage. And I think that is the presentation. You can ask questions if you have any. It is going to be shared as well on the KLAS website for reference. So please ask if you have any questions. Or you can type them as well.
Hi, Nanka. Thank you for the presentation. I'm Maria from UHN. How are you?
Hi, Maria. Good, thank you.
Hi. I have a quick question. You mentioned that the IP will be on the right side, but if you have a study that you have to do daily IP injections, you're not using both sides?
Yes, so that's a very good question. Yes, you can switch and go to the left side as well, but you always have to be very cautious because on the left side of the animal side, there are much more organs there. And if their cecum is usually very large, you would have the bladder will be on the way. So you can alternate sides, and that's the recommendation, alternating left to right and left to right with each day, and this will be better for the animal as well. But always make sure you withdraw back to make sure that you're not into an organ, and then you can inject. Every facility has different days that they do allow how many intraperitoneal injections you're allowed to do. Some of them are 7, some of them are 14. So you need to follow your facility SOPs. And if it's more, if it's over exceeding those days, then always an osmotic pump it's recommended.
Great, thank you. Thank you.
Okay.
Thank you so much, Nanka. That was a great presentation. I really liked how you had the angle of holding the animal as well. A lot of SOPs, I've never seen that listed. Usually it's just to have the head down. So it's great to have that for SOPs and consistency. And also I really liked how you touched on the points of bevel up and keeping that hand still. And that's a great way we can practice with our stuffies is, just the needle handling. So it's thank you so much.
You're welcome. And I always, because we are moving as a research facilities and we are always trying to improve and keep the welfare of the animals and make sure that they are not painful. And I always compare everything that we do to them. I compare it with the people and how would I feel if it's done on me, right? So it is very important to look into that angle and imagine how the animal is going to feel, right? And it's important, I find, even for training, if we use stuffies or silicone models, and we can prevent actually doing it with real training animals. I think the researcher facilities are moving towards this direction. It will be very helpful as well. Just practice, especially practice your drawbacks and injections. It's until you're proficient, do it on a stuffy and not on a live animal, a real animal, which is going to help as well.
That's great. Fantastic. Well, if no one else has any other questions, we'll let you get on with your Tuesday after a long weekend. I know we're very busy. And thank you
Yes.
so much, Nanka, for giving that excellent presentation on.
You're very welcome. And all of you, you have a wonderful day.
Thank you.
Bye, everyone.
Bye.
Bye.